Good afternoon, everyone. I'm Shana Dodge, AFTD's Director of Research Engagement. Welcome to the breakout session, Participating in FTD Research, Advancing FTD Science. As a reminder, this session is being live streamed to our virtual audience. The more we learn about FTD, the closer we come to having effective treatments and a cure. Today, our panel will talk about FTD research, what type of research is being done, how it's helping to advance FTD science, and how you can get involved. Now to introduce our panelists. Dr. Brian Appleby is a neuropsychiatrist who treats and researches neurocognitive disorders, including FTD. He is a professor of neurology, psychiatry, and pathology at Case Western Reserve University and University Hospitals Cleveland Medical Center. He completed a psychiatry residency here in Baltimore at Johns Hopkins University. And Fargusson, at the end, spent her career as a registered nurse and holds a Bachelor of Science in Nursing. About 16 years ago, she was diagnosed with behavioral variant, FTD, and has since taken part in research studies at the UCSF Memory and Aging Center. She is also a member of AFTD's Persons with FTD Advisory Council. Anne is here with her husband, Ed, the assistant to the president of the Northern California Conference of Seventh-day Adventists. Anne and Ed have been married since 1981. And finally, Dr. Dianna Wheaton is the director of the FTD Disorders Registry, where she works directly with persons diagnosed with FTD and their families, and leads outreach efforts to the lay and health professional communities. She has more than 20 years of clinical science research experience and genetic counseling for patients and at-risk family members. Welcome to you all, and thank you for being here. As a reminder to both our in-person and virtual audience members, you can ask questions of our panelists throughout this session. For those of you using the app, you can ask it in the questions tab. For those of you here in person, your red AFTD bags came with note cards in them, and you're welcome to jot down some questions, and we'll have some volunteers later on in the session collecting them. So I was hoping we could start with you, Dr. Wheaton. Could you tell us a little bit about what is a survey, what is survey research, and then a little bit about the registry?
Okay, terrific. Well, surveys are literally a list of questions that are posed to people to help us understand more about a particular topic. And the registry uses a lot of different surveys to help us understand what we call the lived experience of FTD, from the perspective of the person diagnosed, from biological family members and spouse caregivers of persons diagnosed. And you get to answer those questions, and then we use that data to share back with you, as well as to share it with the scientific community and researchers and other clinicians.
Thank you. And can you tell us a little bit about the FTD Disorders Registry?
So the registry is actually for individuals to enroll who are either diagnosed individuals or biological family members or spouse caregivers. There's registration categories for each one of those. And it gives you the opportunity to either join the contact arm of the registry, which is open internationally, as well as the research arm of the registry, which is for the US and Canada, and that's what gives you access to fill out those special surveys to help us understand FTD better. And we can also help then to connect you with research studies that are happening outside the registry. So we will look at your registry profile and then try to connect you, if possible, to ongoing research that's happening relevant to you.
Thank you. And Dr. Appleby, I know Dr. Irwin and Dr. Gendron spoke a little bit about ALLFTD. Could you just explain in general what a natural history or an observational study is?
Sure. So a natural history study is basically not an interventional study. So they're not going to give you any type of treatment or drug or management plan. What they're going to do is they're going to follow the course of your illness. And they do that by giving you a variety of different clinical assessments. They'll look at how you do on different cognitive tests, how you think. They'll ask your caregiver and your family certain questions, and they'll follow you over time. Most natural history studies will see you about once a year. And then they also collect biomarkers, like you heard from Dr. Irwin. And that can be blood-based, it can be from spinal fluid, it could be brain imaging in the form of a brain MRI or a PET scan. And then ultimately, if the family and patient is willing, it would be end in brain donation. And the purpose of natural history studies, again, the ultimate goal here is to treat and prevent FTD, but in order to know how to do that, you really need to understand the basic biology and know what you're tracking, so that when you do have a treatment study, you know that you're actually measuring the right thing to know whether or not your treatment's effective. And that's the ultimate purpose of those studies.
Great, thank you. And we keep hearing this term ALLFTD. What is the ALLFTD study?
So ALLFTD is an acronym of an acronym. I'll leave it at that because I don't remember what the actual acronym stands for. But basically, it's a longitudinal history study, multi-center study in North America that basically enrolls people either with a frontotemporal dementia, that includes behavioral variant FTD, the language variants, PSP, CBD, or those who are at risk of inheriting, or those who actually have a mutation who are asymptomatic. As you can see, there's a variety of different reasons why you would want all those populations in order to look at things like natural history and biomarkers and people that haven't even gotten sick yet from a mutation. So.
Great, thank you. Anne, I know you've participated in a lot of different types of research studies. I was hoping you could tell us a little bit about your experiences and what sorts of things you've taken a part of.
Well, like the doctor here was talking about, I'm involved in a lot of longitudinal studies that have to do with, I've been going to UCSF for about 15 years now, and they take blood, they take spinal fluid, they take MRIs or whatever. And when you go there, they do a lot of cognitive testing and same thing over and over again. And currently, I'm doing what they call a wearable study, where you wear this device. I don't have it on today, but it's a 5-year study where they're checking sweat and your heartbeat and all that kind of stuff. And I'm currently enrolled in the neurofilmlet test, which is like, they described it in the last session, but what it is they come to your house and they draw blood once every 3 months for a 3-year period, okay, and things like that. They also talked about this app that they have on your phone. I recently got that too, and yes, I made $60 on Amazon by doing it, okay? And it's things like you have to stand up for so long, you have to walk for 30 seconds, and then they have some cognitive testing on there. It lasts about maybe 5 minutes. It's not bad for $60. Anyway, and yeah.
Wonderful, thank you. And Ed, I think a lot of the people I speak to are surprised to hear that you don't need to be a person diagnosed in order to participate in FTD research. So I was wondering if you could tell us a little bit about being a care partner, the spouse of someone diagnosed, and your experience participating.
Yeah, certainly part of what I do is support Anne in the research that she does, but part of it is participating myself. I'm in the FTD Registry, and I've done a number of surveys about caregiving through different studies that have been done and being done. And some are longitudinal, some are just a one-time thing, meaning that, you know, some you participate in over time and some you just do a once survey. So I think, you know, that I do whatever I can to be supportive of Anne, but also whatever I can to contribute to the body of knowledge.
Thank you. I think related to that, Anne, I wonder if you could tell us why you've chosen to participate in research, what you get out of it, what motivates you.
Well, I participated in because I have the C9 gene, and I inherited it from my dad who had FTD and had the C9 gene. And so we have identical twin boys that are physicians, and I'm concerned about their health, and so that's another reason I'm involved in research. And basically just to get a better understanding and towards a cure.
Great, thank you. I wonder if any of the rest of you have either heard from people directly or have your own thoughts about why people choose to participate in research.
I think personally, we don't have any disease-specific treatment right now, but it is something that people can do, right? It's a way that they can kind of fight back at the disease and be empowered, is helping research and helping future generations, may even be their own children. So.
And from the registry, I hear that people see it as a way of self-advocacy. It is part of that standing up, wanting to be counted, and make the world know that FTD exists. And it's their way of doing their part to help find a cure.
Yeah, I think all that's true, and I think for, in our family, service has always been a high value for us, and so doing something for others, this disease takes away your family, it takes away friends, it takes away money, it takes away so much of who you are, your job, and et cetera, that to do something that feels like, okay, there's some meaning, some significance that might come out of going through research that may be beneficial, maybe not to me personally, maybe not even to Ann personally, but and maybe even not to our children, but to others, hopefully down the road, that will be benefited by this, give some meaning, some purpose.
Sure. Ann and Ed, I'm wondering where you've heard about research opportunities. Is this something that your clinical team has told you about, or have you had to go out and look for these opportunities?
How I got involved was my dad was in research there, briefly, not the whole time, because when he had it, they didn't call it FTD, they called it
I forget what they called it.
something gliosis.
Yeah.
They didn't call it even FTD at that time. They didn't even call it PICS at that time. Yeah. They called it, granular something. And so anyway, I would meet my mother there, and I would take video pictures of him. He would be kind of catatonic, then not, and I would take pictures, and they just couldn't believe that at some point he could read a newspaper 1 minute and couldn't the next.
Yeah, I'll say that our journey is a little bit unique in that sense, because this all occurred before there was a memory and aging center at UCSF. Mm-hmm. He was going to the neurology department at UCSF. But then when Ann started showing symptoms and we reached out to the neurologist, they hooked us up with the Memory and Aging Center. And then that's led us on the journey to being in touch with various research projects through UCSF.
Great, thank you. Dr. Appleby, we've been getting a lot of questions virtually in this session, and I know in the previous session too, of people saying, okay, I want to participate, what do I do? What would you tell someone who's interested in finding out more about ALLFTD?
Well, I think, as was said before, I'd go to the ALLFTD website, ALLFTD.org, and they can tell you a little bit about the sites that are available and the type of people that they're taking, as well as some of the assessments. But I think the AFTD is probably a good place to go to if you're just looking for studies in general, because they're all going to be FTD specific, and they're always going to be up to date. You can always look at clinicaltrials.gov as well, but you'd have to search for FTD. So the AFTD is probably the best place to go look for studies that you might be interested in, and think about whether you want to do a treatment study or a longitudinal study and how much effort you want to put in or not put in. That's important for a study.
Great, thank you. And Dr. Wheaton, the same question. If someone's interested in getting involved in the registry, what specific steps should they take?
Well, for one thing, everybody that's attending today, in your little red bag, you got a flyer that's two-sided. It has additional information on the back to tell you more about the registry. And for those that are attending virtually, you also have access to our digital version of this document as well. But it's very easy to just go to the registry website and join. It's completely online. And you pick which type of participation you want, whether contact registry or research registry. And just because you pick contact registry right now doesn't mean you can't convert to a greater level of participation when you feel like you can actually handle that level of commitment. but it gives you a very good way to be able to participate in research wherever you're at this point in time, and geographically wherever you're at.
If I could add to that, I as a support group leader, I discovered, because people would get in touch with me from all over the United States, is that there are, it depends on where you're at as to what's the best group to connect with, and that's why going through some of these websites might be really helpful in you finding something close to you. I know that we happen to be close to San Francisco, so UCSF is handy for us. But for other people, it may be a Mayo Clinic or some other location that serves the community. And through these websites, like the AFTD.org website, that's one way, and through the registry and through the ALLFTD and so forth, that can help you get to help near you and resources near you, as well as research near you.
Great, thank you. I know in this session we're not necessarily focusing on clinical trials or medical interventions, but I know some people are curious about how participating in ALLFTD or the registry may impact their eligibility for clinical trials. Is there a relationship between those things?
Well, I'll start first. So the registry doesn't create a barrier to your participation in any other type of research. So it's actually a nice starting point for you to dip your toe in participating in research, and then we can actually potentially help you find other research that you can participate in.
As far as other clinical trials, usually no. It depends on the trials themselves, but both studies that you're interested in. But in general, longitudinal studies aren't a contraindication for doing a treatment study. And in fact, they want to know whether or not you are in a treatment study, because that affects what they're looking at as well. So please just let both studies know.
Okay. And related to that, I think we can all kind of understand how participating in a medication trial would help us get closer to a cure for FTD. I'm hoping you could each explain how participating in something like longitudinal research, how that relates to us eventually having a treatment for FTD, and likewise, how participating in something like survey research might help us advance towards a treatment or a cure for FTD.
It's kind of the hammer and the nail analogy, right? So we know that there are a lot of different dementias, so you have to make sure that you have the right dementia. But even within FTD, there's different pathologies in the brain that are causing the FTD. So it's very likely that our treatment is going to have to focus on whatever that neuropathology is, whatever that protein is in the brain that's being affected. So in order to do that, we need to have a biological marker that can tell us that this person has tau pathology or TDP43 pathology. Right now, we can't do that, but that's essentially very important for treatment studies. And if you look at early Alzheimer's treatment studies, that was one of the problems, is they weren't treating people with Alzheimer's disease. They had something else. So we very much don't want to make that mistake. So being able to find a biomarker that tells us the exact disease pathology allows us to have more finer tuned treatments that will be helpful for people. And then, of course, it also allows us to diagnose people earlier. And as we treat these illnesses, we kind of have a two-part problem. Number one, we have to stop the disease process, but then also we have to reverse neurodegeneration. So the more that we can only solve one of those problems, stopping the disease progression, the better the patients are going to do.
Thank you.
And for the registry perspective, the kind of data that we collect on those surveys, we use that information to actually help inform the broader research community and even biotech pharma, so that they can understand better how to create clinical trials and prioritize what issues are most important to the individual and their families. And so we kind of work hand in hand in that manner. It's a completely different type of data we're collecting for a purpose that's to help support clinical trials that are either ongoing or to come.
Thank you. I know for those of us who've been sitting through all the sessions today, we've been talking a lot about genetics and genetic counseling. And Anne and Ed, I'm wondering if any of the research that you participated in required you to get genetic testing or counseling, if that was a process that was part of any of your research experiences.
Yeah, we had genetic counseling almost every year. You know, what's new out there, what's happening. And then about 5 years ago, when it was more available and they got the okay to do genetic testing, that's when I found out about the C9 gene. Before that, you really didn't have anything. The doctor who told me about this, he said, I can tell you what it is, or whatever, from the blood test we took, and so he told me what it was, and I was really happy, and he goes, he was surprised I was happy. Well, the reason I was happy is because for years they kept saying, phenocopy FTD, okay, it looks like it, okay? And so finally I had a real answer that is what I really had.
Yeah, and I would say that the genetic counseling started before then, and that year that they did tell, we met with a genetic counselor before, and one of the things that was beneficial, I think, was that offer was not just for us, but for our children. Have your children, they were adults, they were actually in medical school at the time, but it was like, you can refer them to us and we will be happy to have a conversation with them as well. So it went beyond just the two of us to, look at the rest of the family, especially those that, our sons might have the genetic defect as well.
And Dr. Wheaton, for the registry, do people need to know their genetic status in order to enroll in the registry?
No, they do not. You're allowed to share that information with the registry. If you do know it, it's entirely up to you. But it is not a requisite to know your genetic status in order for you to join.
And Dr. Appleby, same question. Do people need to know their genetic status or undergo testing to enroll in ALLFTD?
So genetic testing is done as part of ALLFTD, but they don't need to know their status. That's optional. If you choose to want to know your status, when they do the genetic testing as part of the research, then they're going to want to confirm it with something called CLIA testing, which would be a clinical grade genetic test. And thankfully, that's also offered and paid for by ALLFTD, as well as genetic counseling for that. But it's completely optional.
Okay, great. I'm wondering about study partners in research. And the studies that you've been a part of, have you been required to have another person in your life participate with you?
There's one test that he participated in with me, and I'm not really sure why. They don't really tell you, okay? But other than that, you just do it with the person who's there with you, not a partner.
Yeah, I participated in, as she said, in one component of her testing, but most of what I've participated in has just been for caregiver.
And likewise, for the registry and ALLFTD, does a person need to have a dedicated study partner, someone that will participate alongside them?
Well, for the registry, we love it when we have both the person diagnosed and a caregiver, and they are participating in each in their own right, but it's not required that be the case.
And for ALLFTD, study partners are really helpful and important for longitudinal studies because they know the person prior to the changes, but also the person affected by these illnesses often are unaware of the changes. So we have to get the report from someone who sees that, which would be a care partner, their study partner.
And I know you mentioned that you're part of a wearable study, and I'm curious if you've been able to do other research from your home without having to travel into a clinic.
Yeah, mostly because of the pandemic. It's sort of changed a little bit. They will do some Zoom type things with you, that kind of thing. I did several like that without having to go in. But eventually they want you to come in to do the blood test and the MRI and spinal puncture because they need that along with what they're doing.
Sure. And as part of the ALLFTD study, is it possible for people to participate at all from home or from places that are close to their home?
As far as remotely or?
Yeah.
Yeah, so there were some remote options during the pandemic. Our site actually did not have to do that. We were able to do all of them in person. Again, similar to what Ann said, there are a lot of important things that ALLFTD does that require access to the person. So the majority of them, they want in person at this point.
I'm curious, Ann and Ed, what things do you think would make it easier for you to participate in research?
Location.
Yeah.
You know, like I said, you know, we happen to live close enough to UCSF that we have direct access. And last week we were there 2 days and we went home at night. You know, we didn't stay overnight. That can be helpful. I think the other barrier can be the finances, especially in California where gas is now nearly $6 a gallon. You know, it's challenged to travel. And so financially, sometimes it's helpful to have offsetting to that. I think other than that, it's like as much as you can, if it's a survey and you can fill it online, that's helpful, or via Zoom or something like that. But, you know, obviously, ultimately, there's some things you can't do that way. And so that's understandable.
Yeah. I can't think of anything else in that sense, yeah.
Sure. One thing I wanted to ask about was about finding out either individual results or study results. And I guess I'd like to start with Ann and Ed. Have you ever been given results of a study that you've participated in, either about yourself or about the whole
Yes.
group of volunteers?
When you go through the research thing that you do once a year, that's usually a couple days, they always have a family conference. And at the family conference, they'll have several people there, people that did the cognitive tests, they'll have the doctor there. It's like, maybe 5 or 6 people that are there that know about this. And usually the genetic person is there too. And they will talk to you about what they found from the last time you were there compared to the time you currently are there for, whether it's the same or better. A lot of times they'll even show you the MRI results while you're there on their computer and show you about that, and they will tell you, we see this shrinking and atrophying, or we see something else, or we don't see any change. And so you do get some information.
Mm-hmm. Yeah, and they've always answered all of our questions, you know, so that's been helpful to us. Even if it doesn't tell you the cure, you know, even if at least you know where things are at that point in time in terms of what they've tested.
Sure. Similarly, Dr. Wheaton, if someone takes a survey through the registry or they are a registry participant, is there any way to ever find out the results of these surveys?
So you don't currently see your individual result compared against everyone else, but we do release summaries, which are completely masked to anybody's identity, but we do share that grouped data back with the community in documents. We call them infographics, but they are little summaries that tell the story. And we also share that information to the scientific community in a little bit more technical manner than that. But we are working on ways where at some point we hope the registry is going to have a much more interactive way to display information and share it back more immediately with the participants.
And Dr. Appleby, same question for someone who participates in ALLFTD. Can they find out their own results or study level results?
Well, it kind of depends on what the person wants, and not everyone wants to know the gritty details or whether or not they have a genetic mutation or not. So we always want to take that into account first, but generally we're able to share most of the results with the person. Also, all of our studies are published, and because it's NIH funded, it's available to the public, and everyone's de-identified, right? So you can't tell whether or not you're a part of the study, but if you know when you enrolled in the study and when the study was published, you might be able to see that you were part of that study and feel that you contributed.
Great.
One important thing I might just throw in is that, a lot of times though, we don't have answers. And so it's not like the doctor can say, oh, you're at this point or you're at that progression or whatever. They're just giving you what they see and what they know, but there's so much that we don't know that they can't always answer all the questions you might have. And that's fair.
Sure. I guess for any of you, if someone decides that they want to participate in research and then changes their mind, can they stop participating? How does that work?
Absolutely. Yeah. That's what IRBs are for, institutional review boards, is to protect patients, and they should never be coerced into research. So you can stop research at any time. You do not have to participate. It doesn't affect patients' clinical care. So you are the boss of yourself, essentially.
And I'll speak for the registry. You absolutely can choose to discontinue your participation at any time, and it's very easy to do by just contacting the registry by email, and we are very happy to honor that request.
I'm going to move on to some questions from our audience. So we've got some virtual questions, and again, if anyone in the room has questions, please fill it out on a piece of paper or on the note card, and we can have some staff or volunteers circulate to collect them. Dr. Appleby, a question came in about what other research are you involved in outside of ALLFTD? Is there anything, if they live in the Cleveland area, that they could get involved in?
Yeah, so the Cleveland area, despite what you hear about Cleveland, is very nice. All right. But also, we have a lot of dementia-related research between Cleveland Clinic and CASE and university hospitals. Pretty much any form of dementia is covered. Our nation's surveillance system for prion disease is actually in Cleveland, so we're part of that. So there is a lot of opportunities: Alzheimer's, dementia with Lewy bodies, FTD, of course. We also have FTD treatment studies that may be available to some people. So again, just let us know, and we'll try to find the most appropriate study for you if you're interested.
Great, thank you. And Dr. Wheaton, I know you went into this a bit. I wonder if you could remind us who exactly is eligible to participate in the registry, and where do they need to live?
So I'll start with where do they need to live. So to participate in the contact registry, you can live anywhere in the world. And it just is very easy for you to enroll. You have a category for persons diagnosed, biological family members, and even a category for spouse caregivers. And as far as FTD diagnosis specifically, we enroll all across the spectrum of FTD, and that does include, from our perspective in the registry, the primary PSP. I use the acronyms so much I almost can't recall the full names. But we do, in fact, include PSP amongst our accepted diagnoses.
Great. And if someone is involved in a clinical trial, will their information somehow make it into the registry? And same thing with their medical records. Is there a way to connect those things?
It wouldn't automatically happen, but we do use a de-identified coding system that does allow us, with studies that we collaborate and have a data sharing agreement with us, that would allow us to share data back and forth. But for the most part, this is absolutely not an automatic process, and this is managed in this manner to actually help protect data, so that only in specific instances can data be shared.
In our experience, when we have gone for they ask you these questions over and over again. Do you want this information shared, and how far and wide, et cetera, and you're literally letting them know every time.
Yeah, you're signing your life away when you're there.
Anne and Ed, I'm wondering if someone was thinking about participating in research, what questions do you think they should ask themselves or ask the research team?
Well, I would say, you can stop research anytime you want, okay? But I personally think of it as a commitment, okay? So I commit to it because some of them are like a 5-year study, 1-year study, you know, that kind of thing. But it can be exhausting. I mean, you're talking 8 hours of this stuff every day, you know what I mean? And it can get very exhausting. And like we mentioned before, there's usually no reimbursement in cost if you have to go very far. And the other thing is, one thing that hasn't been brought up yet, but once you get like the genetic test, you have to ask yourself too, do I want to know at this time, not just for yourself, but you can't get long-term insurance after that. You just can't. And so you need to ask yourself, when you participate in some of this, you have to realize that that may end up being some of that.
I think one of the key elements is you have to ask questions about how much commitment is this going to be. You know, Ann mentioned the long days. Well, that's long days for 2 days last week, where was our reality. And you have to ask yourself, do you have that energy? Do you have that time? Do you have that ability to do that? I think the other part of it is just the overall emotional toll it can play. And do you have the emotional energy to do this? And I think what's really important is to realize you may start out having the energy. You may discover that you reach a point where it's not working, in which case you need to say, you know, I need to quit for whatever reason. And that's the beauty, is there's no pressure. There really is no pressure. If you say you have to quit, they thank you for what you've done. You know, and I think that's important to realize. But enter into it realizing it is a commitment of some time. So find out how much time are you going to be committed for, over how long.
Great. And Drs. Wheaton and Appleby, from the researcher perspective, are there questions that you would encourage people to ask themselves or ask the research team when they're deciding whether or not to participate in research?
Well, I think Ed did a wonderful job of pointing out what some of the appropriate questions to ask actually are, because you're looking for what's a good fit. And not every study is going to be a good fit for every individual. And so you have to weigh all of those factors and enter into it with your eyes wide open. And then realizing that sometimes it does get to be more than you thought you could deal with. And if that's the case, then you do ask to be removed from this study. And it's true. The researchers will thank you for the time that you committed. So I'll let you follow up from there.
Yeah, definitely, you know, ask about commitment and the timing and all that. And I think it's also important to ask yourself why you want to participate as well. And I think this is especially true for treatment studies because first and foremost, you have to remember that this is a research study, right? It's an experiment. And when you enter into things like treatment studies, it's important to be aware of that and to look at what your motivation to do the study is. I think that helps you choose whether or not you want to do it.
Great, thank you.
I think it's important too that you know that don't count on getting a drug trial. Okay, just don't even count on it. I mean, I've been at it 15 years and I have yet to get in a drug trial. And sometimes your medications, if they have one, will interfere with the drug trial and you're not eligible for that. So I just wanted to mention that.
Thank you. We had a question from the audience. We've been talking a lot, especially in Lainey Dratch's session, about getting genetic counseling because of the possible implications of genetic testing on things like insurance. And we had a question about whether your information from research studies, whether it's protected or whether it could have an impact on your insurance options.
So it shouldn't be connected to, you know, your medical record or a personal identifier. However, one thing that it can impact is things like applying for long-term care insurance or life insurance, because you actually will know your status. And when they ask you in surveys, when you try to get those policies, you have to be truthful. So that's why genetic counseling I would recommend for anyone who's even thinking about getting genetically tested and knowing your results, because they're going to help you prepare for that. Sometimes they'll recommend that you go and purchase those policies ahead of time, because you can always cancel them later. But you definitely want to have that genetic counseling in your pocket before you go any further, so that you can make sure you're prepared for those types of things.
Well, one important consideration in our case, we happen to have identical twin boys. And part of their struggle is it's almost like either one gets tested or they both get tested, because if one finds out and one doesn't want to know, then what does that do to their relationship if one knows and one doesn't, et cetera? It's a complex question is my only point. Do you want to get tested? Do you want to know the result? It's not a simple yes or no. It requires you to think through the implications. That's why having a good genetic counselor is so important before you make that decision.
And Dr. Wheaton, registry data, could that possibly have an impact on someone's insurance?
No, the registry data is strictly research data, and it kind of lives in its own space, and anytime we share it externally, it's de-identified, and the data can never be tracked back to the individual.
Thank you. We've only a few minutes left, and I wanted to just give all of our panelists an opportunity if there's something that we didn't get a chance to touch on. Is there anything else that you would want either people who are interested in participating in research, or maybe people that are conducting research, to know about or to hear from you?
Well, I will just say some of the research can be kind of fun, like this app I'm doing or whatever that they mentioned in the last thing. I've had all kinds of things from little tiny sandwiches to eat to drinking things that are sour, sweet, and so you're going like, what does that have to do with anything, okay? But it's all part of research. It's not just what I mentioned about cognitive testing. They do some other weird type of things, in my opinion. Okay?
Yeah. I like to encourage people to participate in research to the degree they're able to. And I think that's one important thing that I just keep emphasizing, because there are even some of these tests that are very uncomfortable. Yeah, and can you tolerate that level of discomfort? You think of a lumbar puncture, that can be quite a challenge sometimes. And so you have to kind of think about if you're gonna volunteer, think it through before you do it. But I do encourage people, to the degree they're able to participate, please do.
And I echo that. The registry really is there to help facilitate research, and we realize not everybody is ready to participate when they first find out they're diagnosed. Sometimes that's just too much, but we're here to help you when you do want to dip your toe in and start participating in research. You can take it as baby steps, and we can help you perhaps connect to more extensive studies later when you feel that you're ready for that.
So on behalf of the researchers, we're very appreciative of those who do participate, but we also realize it's not for everyone, right? And that's fine. There are some patients that are so distressed by the illness we would never even think about offering research, because it's just not in their best interest. And I think the other thing that we haven't talked too much about is the importance of caregiver research, especially with an illness like FTD. It's extremely important because management is such an issue, and the caregivers are going to be our best way to look at that. So, and I think FTD has done a good job so far at caregiver research, and that's why it's important to have study partners and caregivers involved.
Yeah, if I had a word to researchers, it's realize that you see the patient for a period of time. We see them every day.
Yeah, that's a great point. And I know there are a lot of studies focused on the caregiver experience that you can access through the registry or through AFTD's featured studies page. So if that's something that you're interested, I'd encourage you to go to those sites. We're going to wrap things up now. I'd like to really thank our participants for sharing their insights on FTD research, and thank you so much, Anne and Ed, for being research volunteers. At this point, we're going to take a 15-minute break, and the conference will resume here in the Grand Ballroom at 3:45 Eastern Time. Thank you.